I'm Dr. Michael Miyazaki, and today I'm going to discuss one of the most challenging types of composites, I think, for me to place, and that's the composite veneer. Now, one of the challenges is that when we do a veneer, we're covering a large surface area, and sometimes you take that composite and you choose a composite with some really good physical properties, but it's really thick. And as you spread that out over the tooth, it's kind of like if you take a baking roller and you roll across dough. Sometimes the dough kind of sticks to the roller, and as you're trying to flatten it out, it starts to roll up behind the roller. I don't know if you've ever had that happen. And then if you don't place enough material the first time and you add a second layer to that first layer, and then you cure everything and you polish it up, you get the little white line between the seams where you can tell where the first layer was placed and then the second layer. So doing a large surface area type composite has its challenges. And yet today, patients may come in and elect to do a direct composite veneer because they want a nicer looking tooth and the cost could be less than a lab fabricated veneer. Or even if we're doing a small composite like a class 5, having the technique that we're talking about today makes it so much easier. So let me show you. Over here on the other side of my slide here, at the very bottom, those are composite warmers. Now the first one closest to me, that's a benchtop composite warmer. We've been using that for years, works really, really well. And if you haven't heard about warming your composite, one of the big companies making a big push has been 3M recently. Why? Because it makes placing a composite so much easier. Voco has a very highly filled composite, and when you squeeze that out of the composite dispensing gun, it's very thick, and to spread it is very difficult. But it has a lot of the great physical properties you want in a composite, but it has so much filler in it that it just makes it a little bit harder to handle. Some composites we use can be naturally sticky. Place those same composites in a composite warmer, and your handling gets so much easier. It's like spreading warm butter over a piece of bread where it just goes into all the little nooks and crannies versus a cold slab of butter on a piece of toast where all the crumbs fly all over. So you want to warm your composite, and research has shown that you get better adaptation to your cavity preparation. It improves the physical properties of the composite, and you get better depth of cure. So there's so many positives to warming our composite. It's just many of us haven't been exposed to that. So that's what I'm hoping to do right now. So with the benchtop composite warmer that you see over here, that just sits on our bench. We have compules of our composites sitting in there, and they're just ready to go. Or you could put your syringe composite in there. You can even put your local anesthetic to warm it up in there, and you see the composite gun just fits into a little opening. So that's very convenient, and everything's ready to go. A little bit further to the edge of the slide, on the other side of the benchtop composite warmer, we have the Phasor. The Phasor is a composite gun, so that's how we deliver our composite right out of our little compules. So I use compules because they're just easier, it's cleaner, and single use. So I pop the compule into the Phasor, turn the button on, and within 45 seconds it's warmed up to whatever temperature you desire. There's 3 different temperature settings, and when you get the Phasor, it has a little chart. Match that chart up to the composite you use on a regular basis, and it'll tell you which temperature setting to set the Phasor. Then from there, once it's warmed up, I can express it straight out of that gun. The composite again comes out much easier. It's easier to extrude, and it's easier then to work with. That composite gun will stay on, so if I put it down and I'm shaping my composite, when I go back to it, it will not have shut off as long as I get back to it within a couple minutes. After a couple minutes, it will shut off to save the battery. Just hit the button again if you need to, and it's going to warm up very, very quickly. The Phasor is very nice to use. Now, most of the composites that I do, I usually don't use more than one compule. And if I do, what I'll do is I can sense that I'm getting towards the end of the compule by how far I can squeeze the composite gun. And as I'm smoothing that part of the composite out, my assistant can put another compule in there, activate the gun, and again, within 45 seconds, it's going to be warmed up and ready to go. So the fact that it is a compule type composite gun that we're doing all the heating in isn't a disadvantage. It just makes life pretty easy. Above this over here, you see the pink wave curing light. Now that is a 4 wavelength light, and it's a high intensity light with a very large lens, over 12 millimeters in diameter. So I want a light that will cure my composite completely to the proper depth of cure and do it fairly efficiently. So if I had a smaller lens, the circle that the light's emitted from, and I was doing a central incisor that maybe was 11 millimeters from gingiva to incisal edge, I might have to cure the gingival half and then cure the more incisal half and have a little bit of overlap in the middle. When I do a central incisor or a molar in the posterior of the mouth, this is a very low profile but high power light. I can cover the entire tooth number 8 with that lens, cure it for 20 seconds, and I get the whole tooth and I get all the composite cured to depth. And that's very important. What you see a little bit further up on this slide is the seam-free. Seam-free is a composite wetting resin. So that is what actually will help me spread that composite that I've warmed up and I've placed on the tooth. And now the seam-free will help me spread that composite, and it'll help me contour the composite. So I spread it, I contour it, but it will not add any film thickness because there is no filler in this. There's no additional photoinitiator and there's no additional solvent. So it will not affect the physical properties of my composite. It's just going to make the composite placement that much easier. So I'm going to warm my composite up. I'm going to place it on the prepared tooth, and then I'm going to use my seam-free with any composite instrument. I don't even have a special composite instrument. And I just spread that composite out and then contour it. The seam-free and the warmth of the composite helps me do that. And then I'll cure it with my pink wave curing light. And it becomes very, very efficient. So let's take a look at how this will work.